Are you ready to take control of your own health? Do you want to create a plan that will improve your health and vitality without the use of synthetic drugs or needless surgery? Hi, this is Dr. Tom Roselle. I would like to invite you to join me and the Roselle Center for Healing for an information, fun-filled day that will change the state of your health and quality of life. Ageless Health 2011 will provide you with the resources to begin your journey towards being stronger, having greater physical performance, and living longer without impairment, pain, or disease. Ageless Health is about realizing that your health is a do-it-yourself program. You can have it all. Ageless Health 2011 is your first step towards creating and enhancing your natural health plan. Register today to reserve your seat.
Ageless Health 2011 is September 17th at the Fairview Park Marriott. Learn more at rosellecare.com. Don't miss out Ageless Health 2011. Register today. Call 703-698-7117. 703-698-7117.
Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. I am live in studio. 888-630-9625. That's 888-630-WMAL. That's how you talk to me today. You've had a problem and you've tried to put the fire out any way you can and you haven't come up with the fire hose yet. Well, this is the place. Let's see what we can do to change things for you and actually do something without all the drugs and surgery that you're contemplating. This hot July day is one where we should contemplate who we are health-wise, because I'm not going outside for too long today. It is nasty ugly. I'm without a hose, and we're going to put the hose out on your fire, 888-630-9625. But I want to also let you know and invite you, those of you who have constantly called the office and sent emails and said, why don't we do a program in Maryland? Why do we have to come to your office all the time? Well, your prayers, your thoughts, and your attention has got to us. So here's the deal. This coming Wednesday evening at 7:15 at the Bethesda Chevy Chase Regional Services Center, I am going to be presenting. I will be there. Yours truly. I will be doing the class on Health is a Do-It-Yourself program. We're going to talk about my book. We're going to talk about the applications within the book. We're going to show you how to take this stuff as a manual to increasing your wellness quotient. Take it above the cut and make a difference. The presentation is being co-sponsored by Caring for Others, a charity foundation that we work with ongoingly. We'd love to have you there. Please be our guest. Bethesda Chevy Chase Regional Service Center this Wednesday evening, the 20th. At 7:15. To register for that, all I want you to do is call my office at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend in Bethesda this Wednesday evening. I will be there, and I hope you will be as well. We're going out of our way to do this for you, for those folks of you who are in Maryland, because you asked for it. 888-630-9625. So what's that program going to be about? We're going to talk about many different things Wednesday night. We're going to talk about, the total concept of health, the triad of health that you've heard me talk about, structural, chemical, emotional. We're going to talk about how they integrate, how when you actually have a fall or you have an injury or you do something structurally to your body that it's not going to work the way it's supposed to, but more importantly, how it affects the emotional side, how it affects the biochemical side, and additionally, how the chemical side, all those things that you eat that you shouldn't be putting in your body, how those things affect you structurally, biochemically, how they ultimately affect your moods. And speaking of moods, we have a little bit of a synopsis of something that I was reading in the last couple of weeks in the journals. It's vitamin D and depression in seniors, and we'll get to that during the program. It's a very interesting correlation, something that we've known about forever. But the emotional piece, if your brain isn't working the way it's supposed to, when I say that, what I'm talking about is your emotional piece. If those biochemistries aren't balanced, then everything else is affected. So this Wednesday night, we're going to talk about the book. We're going to talk about Health is a Do-It-Yourself program. And we're going to pull all these things together. We're going to talk about the 5 factors. We're going to talk about what ageless health really is. And we're going to answer your questions. I will answer your questions because I'm doing the class. So give us a call, 703-698-7117. Tell my staff that you want to be there and make me want to go back to Maryland again. Okay? Let's talk about some other things that are very important to you. Let's talk about if we have that opportunity today about some sort of allergies, because that's another question that has been coming up on the radar screen simply because of the program that was aired June the 23rd, a Thursday evening on MTV, True Life, the reality program. And you say, well, what were you doing on MTV? Well, January, let me tell you the story, what happened. In January, I get a phone call to the office, and they said they were representing this young girl, and she had very severe allergy patterns, and because of her allergies, she would go into seizures, she would go into anaphylaxis, she would be in and out of the hospital, she was on all kinds of medications, and nobody seemed to be able to help her. And there was the chances of her going to college, because she's a senior at one of the local high schools, was slim to none. And would I look at her? And the short end of the story was when we answered the phone and did our due diligence, normally I would say, no, I won't do this, because they were going to have a television camera in my office and the like. And I said, yes. I don't know what made me say yes, but I said yes, something I normally don't do with this, because they can be spinned, as you know, differently. So over a period of 2, 3, 4 months, we treated her, and the outcome was fantastic. Off of generally all of her medications except for a half of a tablet of one, she is functioning at a very high level. She has not had any problems since, and she's going to school this fall, which is a great thing. This young woman will be my guest within the next couple of weeks, and you'll be able to ask her some questions directly about the trials and travails and so forth that she's gone through, but I think you're going to find it fascinating. But having said that, let's talk about allergies a little bit, because this has been one of the worst years I've ever seen. It's been a year that people have digestive problems, and they have allergy reactions, and they have lung problems, and they've had fevers, and their nose has been plugged up, more so than any other year I can remember since the 35 years I've been in practice. It's been awful, and many of you have been suffering from it. So why is that? Is it because our bodies are being less able to handle all of these things out there? That's part of it. Is it because that we have more junk in the air? That's part of it too. Is it because that there may be some other things in the environment that weren't around, and who knows how they got there? Probably. I'll talk to you that privately, but I have some ideas about that as well. But nevertheless, people have been suffering and coughing. They've had this cough that is hacking and hacking and hacking and hacking, and it just gets worse at nighttime. And it's like you can't sleep. Even if you wanted to, you can't sleep. So you go to your physician, he puts you on all kinds of things, and you feel worse sometimes because of the drugs and the medications, but your health is being undermined. So let's talk a little bit about why the body becomes more susceptible. First, those of you aware of what I'm talking about, and you have to be because it's been in the workplace, it's been with your friends, if not, it has been you. The immune system is one of those things that only works if your body is in a good state of wellness. That means everything's working optimally. When you breathe things in, your mucus, your saliva, begins the process. There's something called mucus secretion, SIGA antibody. And then that kicks in, and that handles molds and funguses and bacteria and neurotoxins, and begins to break these things out. So you don't have to get the rest of your body built or accosted. So the next piece is that it goes to your stomach. Now, your stomach should produce adequate amounts of digestive enzyme, hydrochloric acid, for example. Well, hydrochloric acid is your friend. It's not this thing that you run to your doc and get Pepsid and all those things to knock out the fire. Most of that indigestion, which we're going to talk a little bit about today, by the way, is due to the lack of adequate amounts of hydrochloric acid, or that valve at the top of the stomach not working properly, so things leak back up a little bit. But the idea is not to shut the digestive system down, because you need those things. You need it to break down your proteins and absorb calcium and fight disease, bacteria. Any of these microorganisms, Enterobacter, Klebsiella, anything that, some of the molds and funguses, some of the environmental stuff that gets into your system and gets that far, what happens is that the acid breaks it up, and then your immune system can further take over and begin to handle that stuff. But if you don't have enough hydrochloric acid, if you don't have enough pepsin, if you don't have enough digestive components to the stomach, and then when it gets in the upper part of the small intestine, you're in trouble. You're in trouble for a lot of reasons. You're in trouble because this stuff now passes through into the intestinal tract unaccosted. It can set up housekeeping. It can begin to grow. It begins to suppress the immune system in the gut, which is one of the primary areas that you ward everything else off. Now, when that intestinal tract gets shifted, if you will, now these things begin to absorb into the body, and you have a problem. So what happens? Why does it go to the lungs? Why are the lungs so susceptible? Well, in integrative care, we respect body cooperation. And what that means, there are different pieces of the puzzle that relate one to the other, different pieces of your body puzzle. Every organ system has a mate. For example, the stomach works with the spleen. The spleen is this little organ that sits and produces immune factors. It also puts out red blood cells and so forth. The kidney works with the bladder. The liver works with the gallbladder. But the large intestine works with the lung. So when the large intestine doesn't work adequately, then the lung is going to be more susceptible, and that's where we're getting in our trouble. These things are getting in, and we're getting the lung energy depleted, and now you get sick or more susceptible to the stuff out there that can make you sick. See, it's not the bugs that are getting you. It's your body's inability to handle the bugs. I'm going to put a little bit more of a light on that with you this Wednesday evening, and we're going to go over my book, and we're going to talk about Health is a Do-It-Yourself program. So when you're there, we're going to get very intimate with this stuff, and I'm going to kind of put it together for you. Bethesda Chevy Chase Regional Service Center this Wednesday evening, July the 20th, 7:15. It's on 4805 Edgemore Lane in Bethesda. All you got to do is call my office at 703-698-7117. I'm the one that's presenting, yours truly, and we're going to talk about this stuff as long as you'd like to before they throw us out, but we're going to get to that place. And I want you to understand what happens. Do you know that you get more susceptible to stuff as you get older, these bugs and so forth? And the reason for it is because we have low stomach acid production. And that's what I want to talk to you about today. We're going to talk about how much anti-aging therapy, really misses the point. And it's sometimes not about the hormones that are out of balance, because we look at that secondarily. Sometimes it's not about, the DHEA and the testosterones and the inadequacies. Sometimes, if we really want our body to work properly, we have to look at where it starts, and that's the area that we look at less, and that's the stomach, the digestive system. In anti-aging efforts, we talk about the control of something called free radicals, and those are the things that damage the body. And we take these antioxidants, these things that supposedly slow the aging process, much like putting something in our car to protect the engines and so forth and ward off the wintertime insults and yada, yada, yada. And we're told to take all kinds of vitamins and these synthetic hormones and so forth. But what we don't understand is that there is a place that all of this starts first. And we're going to talk a little bit about the endocrine theory of aging. We're going to talk about the digestive failure theory today, and the things I really want you to understand and know about that, because it can make a big difference. It's huge. So many of the things that we see with patients, from degenerative disease to loss of calcium, osteoporosis, the inability of the body to work, the bloating, the distension, all of those things, then you go to your local doc and he gives you stuff to take. And, there's an article in the Journal of the American Medical Association that tells that only 10% of healthy older people have adequate levels of stomach production or stomach acid production. What's that all about? 10% of you. Otherwise, the rest of you don't have enough to break it down. So as we get older, we get sicker. We're more susceptible to pneumonia. The old statement that, pneumonia is the friend of the elderly. Why? Because you suffocate in your sleep and you die? That's not the way it's supposed to go. Let's figure that out. Throughout the program today, we're going to talk about those things and many other things that you'd like to talk about. We already have some callers. We'll take those when we come back. Remind you that this Wednesday evening I will be at the Bethesda Chevy Chase Regional Service Center, and we're going to be doing a whole evening on Health as a Do-It-Yourself program. Give my office a call at 703-698-7117 in Bethesda at 4805 Edgemore Lane. I will be there Wednesday. Don't go away. You be here as soon as we come back.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're at 888-630 WMAL. That's 888-630-9625. Love to talk to you on any subject. This Wednesday evening, I'm going to talk to you on a very special subject. We're going to talk about Health is a Do-It-Yourself program, which is the title of my book. And we're going to go through it. We're going to show you how to use it as a manual. And the program is being sponsored by Caring for Others, a charity, a foundation. So there's no cost to you. It is a free presentation. However, what I'd like you to do is register for that class at 703-698-7117. It's being held at the Bethesda Chevy Chase Regional Service Center, and it's located on Edgemore Lane in Bethesda, 4805 Edgemore Lane to be precise, and it starts at 7:15. Love to have you there. Love to talk to you. I'll be the guy that will be talking. So let's see you all there. Those of you who've asked for a presentation in Bethesda, let's see what we can do. Let's do them again if this one turns out really, really well. We're talking about digestive function and allergy reactions and all these lung problems that you all have had, and we're going to get into that deeply, but I don't want to be disrespectful. Lily, how can I help you?
Hi, Dr. Roselle?
Yes, ma'am.
Yes, this question is actually for my niece. She's about 33 years old, and back in April, she had an infection, so the doctors gave her Bactrim sulfur.
Yes.
And after she took the second pill, she became severely allergic to the medication. Her tongue was swollen. She almost went into a seizure, so they had to take her to emergency. So she stopped taking the medication, and the infection has cleared up, but she still has all these bad symptoms. She has lost 20 pounds. She feels lightheaded. She's sensitive to smell, and she feels depression coming on. And she has also has a rash.
When did all this start? How has she been playing with this for a year or two or 6 months or 3 months?
No, back in April, so it's been, 2 months? I thought that if it is they told her that she has serum sickness, and when I looked it up, it should, cleared up after a week or so if you're allergic to medication once you stop?
Well, Bactrim is a antibiotic. Do you know whether Bactrim was Bactrim DS or just the old-fashioned Bactrim?
I am not sure. She just told me it was Bactrim sulfur.
Okay, the Bactrim, the medication Bactrim has some nasty side effects, but it's a sulfa drug also combined with another antibiotic, and it treats different types of infections that are specific bacterial types of infections. If it's something else, it doesn't work. And they use it to treat everything from ear infections to diarrhea that you get if you went to Mexico, urinary tract infections, bronchitis. We've seen a lot of that this year with these patients have complaining about all this coughing and these lung problems that have gone bacterial. The problem is that the side effects sometimes with these things are worse than the other. It should never be taken, by the way, and not in your nieces, but I just want to put that out there. Anybody who is pregnant, because it can cause problems, but you can cause problems with anemia, and you can cause problems with the blood generally across the board. It will cause something called eosinophilia, which the eosinophils are types of white blood cells. And these are the things that help protect you when you have an allergy reaction. But if they get them so they knock down, then you got a problem. Now, the allergic reactions that are associated with this can have to do with the heart. It can give you fevers. It can give you all the things that she went in to take the drug for. Mm-hmm. And unfortunately, what's happened is it's knocked out her intestinal system. And so she has no immune response coming from that area. It can cause her to lose vitamin K and also calcium. It suppresses the absorption. The joints are going to ache. You're going to have that type of consideration as well. So you have to see what the immune system is. You have to look at the blood system. You have to look at the intestinal tract, but also you have to look at the adrenal system, the fight-flight system. The adrenal is important because it shows the secretion of IgA antibody, your mucus IgA, and that's her first line of defense. So not knowing what the full history is and what other situations led up to this, and an examination and history would tell that, you have to really kind of look at this thing kind of one layer at a time. In the meantime, I would go to a health food store, and a good one, either the Apothecary at Wegmans or Whole Foods or Trader Joe's or Mom's or something like that. Ask them for the highest quality, the greatest strength bacterium that you can put in the intestinal, like a probiotic that you can put into the gut, and you want to take it probably double the dose of what's on the bottle, maybe 3 times a day, but start slowly. Do one, and if that's okay, then go to a couple and so forth. But without knowing exactly what's there, what immune systems are being challenged, it's very difficult to say, do this, because I don't know the entire case. But that's what you're looking at with Bactrim. Bactrim can knock things right down to the patient's knees, and it's very, very tough coming around. But start with the probiotic, the good bacteria, at a very, very high level. Obviously, we could do far more if I knew more information, and be more than happy to talk to her at any time. Have her contact me online. I'll be more than happy to go back and forth with her.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio. 888-630-WMAL. That's 888-630-9625. Love to talk to you on any subject you have in mind. I'm going to talk to you Wednesday night, the 20th of July, and I'm going to be at the Bethesda Chevy Chase Regional Service Center because you asked for it. That's why I'm going there. The center is located at 4805 Edgemore Lane in Bethesda. We're going to talk about Health is a Do-It-Yourself program and how to integrate the pieces. I'm going to show you how to take my book. Many of you, thousands of you bought it, and we're going to show you how to use it as a manual to change your life. It's a program that I lovingly like to do, and we'd ask you to be there by 7:15, but to call our office at 703-698-7117. That's 703-698-7117. So for those of you in Maryland, this is a special for you, something that I've been asked to do repetitively, and I finally said, okay, I'm coming. So the Bethesda Chevy Chase Regional Service Center this Wednesday, 7:15 p.m. 7:15 is what we're going to start at, July the 20th. So call my office, register, say you'll be there, and I'll be there for you. Let's go to the phones because it's very interesting. Instead of talking about thermography centers like I usually do, and I would love to have you call them, by the way. Thermography centers is always one of our primary sponsors of Dr. Tom Roselle Live, and you can call Dareth Painter at 703-943-7248. But having said that, Sheila, you're waiting patiently. Let me answer your question for you.
Yes, I listened to you last week, and then I got on my computer, and I found out that the thermography is not recognized by the American Medical Association, and that one would first have to go for accepted tests.
Yeah, so here's the deal. And let me try to kind of put it into a realm. Remember who owns the medical industry, and it's called Big Pharma. And everything that you do, most of the insurance boards have medical physicians that are sitting on it, and they decide what it is they're going to do and if it's within the scope of their practice. Now, years ago, Medicare covered acupuncture. And that was, we go back 6, 7, 8 years ago. Today, guess what? They don't cover it anymore because they were looking for a place to snip. Years ago, there was limited coverage on things relative to nutrition. The only thing that you can get Medicare to cover today is if you, nutritionally, to go to a nutritionist or whatever, is if you have diabetes and it's recommended by your physician. Other than that, they don't pay for anything. Now, some of the insurance companies across the board, there are a few, by the way, that have limited coverage for things like thermography. But if you have, for example, if you have your annual mammogram, they'll pay for that. They got a lot of money invested in those things, and they've, they say this is the way to go. What they don't tell you, the side effects and the other compounded problems that are associated with it. However, if you have an ultrasound done before you do a mammography, they won't pay for it. And ultrasound can actually show you whether there's a lump there or not a lump there. So it depends a lot on the carrier. So if you studied insurances from California to Virginia, all of them have very different coverages. Medicare is ridiculous across the board. They're covering less and less and less and less. But all I can tell you, Sheila, is that within the next 2 to 3 to 4 years, they're going to realize that thermographic imaging has a place in ongoing diagnostics. Now, the imaging has been around for a long time. The FDA has looked at it and said, yeah, this is really good stuff. There's many medical physicians across the country that are using it. The only people that read these films, or they're pictures, they're not films, read the films are medical physicians. They're the only ones that do it. And so that tells you that there's an incongruity there someplace. That's about the best I can do to answer your question, but understand that it's all a political economic game.
I understand.
And it's
now,
going
if
to
one
change.
has a whole body thermography, what does it show? Because on the computer they were just talking about breast cancer.
Well, if you go back on the computer and look at the website, there's other things, but you can also get information sent to you. It will show like the carotid arteries in the neck. A lot of people will begin to clog the arteries so you don't get the circulation in the brain. That will show the heat signal that tells you that you have high levels of inflammation. Those things, that will show up. It will show any vascular problems in the arms and the legs. If you have any superficial tumor areas that are beginning to come about, that again, those things will show up. So what you have to remember about thermographic imaging is it's showing the heat signal that is attributed to inflammatory reactions within the tissue, within blood vessels, and so forth. It'll show things in the mouth, and then TMJ. It'll show when you have an infection, so to speak, it gets really hot, and it'll show that. A lot of times the dentist will miss it. Thermographic imaging will show that up. So when you have a full-body thermography, you begin to add this piece of data to other pieces of information, blood work and ultrasounds and normal, physical examinations that you're getting, and where some of those things won't show the initial stages of development, thermographic imaging will. Because remember, it compares one side of the body to the other. The signals from one side to the other have to be the same. If they're not the same, then there's a problem.
I understand.
Okay? Sheila, thank you for your phone call. I hope that's at least a somewhat of an adequate explanation. But go to the thermography website and get a hold of Dareth Painter, and she will give you more information about that. We're here at 888-630-WMAL. This Wednesday evening, I will be at the Bethesda Chevy Chase Regional Center just for you, because you asked me to be there, and we're going to be talking about Health is a Do-It-Yourself program. I'm going to show you how to take my book and use it as a manual, and so you can implement good things in your health. It's at 4805 Edgemore Lane. Be there at 7:15, and I will stay as long as you want. You don't have to go out for a cup of tea afterwards and talk to you even further on. We're talking a little bit about the intestinal tract, because so many of you have been suffering from lung problems and allergy reactions and so forth, and when you put the pieces together and you realize why the body is not working the way it's supposed to, why it's not working the way it's supposed to, it makes sense. If you have low stomach acid and you're falling for your doctor telling you that you need Zantac and Pepsid, these drugs and others like them simply make the matter worse. They shut things down. If you're actually getting some acid, it's because of leakage of the valve that's at the top of the stomach, and it leaks into the esophagus. But that's not due to a physiological dysfunction of stomach acid. That's due to the nerves that go to that valve not working. It goes to that muscle, the diaphragm, that's putting abnormal pressure on that. That can be handled mechanically. We have so many patients that we see that their doctors have put them on all this nonsense, and once they start getting treated, once they get the chemistry begin to balance. We talked a little bit earlier about a patient, a caller called in and said, her niece had been on all these, or this nasty drug Bactrim, and one of the things it does, like every other antibiotic, is knocks out the intestinal tract. So what you have to do is you have to put the good bacteria back into the system. Because if you don't, it's going to burn. It's going to make life worse. Things are going to rot in your stomach. They're going to putrefy. And that affects the lungs. And if the lungs don't work the way they're supposed to, then you're going to have all these allergic responses. If you don't have enough hydrochloric acid, you're going to have allergic responses. So we need to change this. See, you can do this stuff by yourself. You don't need anybody else. If you exercise properly, if you really eat the right way, you get the garbage out of your system, and you learn some basics about taking care of your health, it's amazing. It's amazing what your body will do. I was online the other day, and we were looking at different age groups of exercise, above 30, above 40, above 50, above 60, above 70. And it's amazing to me that we forget that the body can repair almost anything. And you see these people that are in their 70s, and they have bodies on them like they're 20 years old. Where did that come from? That came from their not buying into what's called a social hallucination, an expectation that when you get to a certain place in life, it's all over with, that you can't repair anything. I've spent 35 years telling patients that you've got to do X, Y, and Z. And what they do is they say, well, Z is okay, but X is not, something I'm going to deal with, and Y is like, well, maybe if I have time, if I have the opportunity. But you can turn things around. Health is a do-it-yourself program. It's all about the choices that you make. See, where you are right now at this moment in time is because of all the things that you've decided to do or decided not to do. I mean, it's a double-edged sword. So, make a decision that you're going to change things for yourself, that you're going to turn your life around, that you're going to make a difference, that you'd like to breathe better, that you'd like to not have these crashes in your immune system, that these allergies that come about and the inability of your white blood cells to work to protect you isn't as strong as it should be. We do all kinds of blood testing, and it's amazing to me how the parameters of blood testing have changed over the years. For example, just take a typical white blood cell count. A white blood cell count is a measure of your body's ability to protect itself. Just the numbers of it first. And when I went to school, the lowest level was at 5,000, and the highest level was about 8,000. Anything above that or anything below that chronically was an indication that there was either an acute process or a chronic process going on, particularly an infectious type of situation. Now you take a look at the laboratories, and they've dropped the 5,000 down to 4,000, and the 8,000 has gone up to 10 to 11,000. And because what the laboratories are basically saying by altering this is that there's more and more sick people out there, so that sickness, that inability must be normal. So just because they say it's normal doesn't mean it's normal. We look at thyroid hormone panels and so forth. Patient comes in and says, well, my doctor said, and I look at it and they said, not so much. Thyroid TSH, thyroid stimulating hormone, which the bottom line is like 0.58, going up to 5. The textbook normal range is 1.8 to 2.2. But everybody says, well, it must be within the parameters. They don't look at the structure. This Wednesday evening, I'm going to be with you. I'm going to talk about all these things. We're going to put it together and try to make sense of what's happening in your life. We're going to talk about Health as a Do-It-Yourself program at 7:15 at the Bethesda Chevy Chase Regional Service Center in Bethesda, Maryland, because you asked me to be there. 4805 Edgemore Lane. Call my office at 703-698-7117. Joyce, quickly, how can I help you, my friend?
This Wednesday evening, I'm going to...
Joyce, turn your radio off.
Okay. Yes, sir. I have ulcers in my mouth from time to time, on my tongue and under my tongue.
And they just don't seem to go away. Do they burn? Do they hurt? Or do they just show up?
They just show up and they hurt.
Okay, so there's a couple things. It probably has to do with the balance of bacteria within your intestinal system, and or levels of herpes simplex that you have in your mouth. One of the two, and looking at them would tell the difference. But one of the things that you should try is to balance your digestive system. Go get yourself a probiotic, and start taking that every day. Get rid of, and I'm going to give you a list, not an accusation: sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, junk stuff.
The only one I take of that is I get some sugar.
Okay, so try to eliminate that because you'll grow bacteria and you'll grow mold and fungus with that. But try just for a short time. You can do anything for a couple of weeks, and then load up with the good bacteria and see if that helps you.
What is a good bacteria, sir?
It's called probiotic. It's just ask them for a good probiotic. There are several different ones that usually come in combination, and that will help. But do that, and then let me know what happens by just doing that.
Okay, now where am I going to go get this?
You're going to go to Mom's, or you're going to go to Fresh Fields, Whole Foods rather, or you're going to go to Wegmans, okay?
Yes, sir.
Joyce, thanks for your call. I appreciate it.
Thank you so much. I really enjoy you. I appreciate it so much.
Thank you, Joyce.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live as every Sunday at 12 noon. I'm here on WMAL, and you can reach me by going to 888-630-WMAL. And if you can't get to me during the show, go to RoselleCare.com. That's RoselleCare.com, RoselleCare.com, and we will always get back to you. This Wednesday evening, don't forget, because you asked for it, I'm going to be at the Bethesda Chevy Chase Regional Service Center in Bethesda, Maryland. 4805 Edgemore Lane. We're going to be talking about Health is a Do-It-Yourself program. We're going to show you how to use my book as a guide, a manual to really put your life together. How do you do it? The decisions that you have to make. How do you get your head to change? How do you stop doing the things that you've been doing forever? Well, I'm going to put that piece of it in the puzzle for you. I'm going to show you how to do it. We're going to kind of do the check marks across the board and answer your questions. Obviously, this is going to be a fun night. I'm really going to have a good time with you, knee to knee. It's going to be at 7:15, July the 20th, at the Bethesda Chevy Chase Regional Service Center. Call my office at 703-698-7117. That's 703-698-7117. And I'll see you there. It's going to be fun. I'd like to meet a lot of you, too, that I haven't had the opportunity to meet before. So many of you are from the Maryland area, and you call us up and say, I wish you were out there. Well, guess what? I'm coming out there to you, so let's do it. Beforehand, Colette, how can I help you?
Yes, I'm glad you took my call. Let me turn off this radio.
Okay, we have a minute, honey, so give me the information.
My side, I have the pain on my right side, right above the waist. I was told probably it is kidney stone, so I had that ultrasound, MRI, and nothing appeared. Nothing. There's nothing. Just I don't know what's the pain.
Okay, so with
hard breathing.
That's pretty easy. That tells me that it's muscle balance. What's happening is one of the muscles have weakened in comparison to the other one. Is causing the vertebrae in that lower area to go out of position, so you're irritating the nerve. So what has to be done is we have to find the muscles that are not working the way they're supposed to and fix them, either by taking the pressure off the nerve or restoring function to the acupuncture energy or fixing the nutritional relationship. But it's always that sort of situation. When you don't find a tumor, unfortunately, medicine looks for the most weird and bizarre things when things are usually very simple and straightforward. So, love to help you. I wish we had more time, Colette, but that's probably exactly what it is. You can give us a call and be glad to fix that problem for you.
All right. Thank you.
You're welcome. Thanks for your call. We're here every Sunday at 12 noon bringing you the most up-to-date information. You can always find me at RoselleCare.com or call us at 703-698-7117, and that's the number you call to see me this Wednesday at Bethesda Chevy Chase Regional Service Center at 7:15. We'll see you next week. Have a great day. Bye. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, RoselleCare.com. That's RoselleCare.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is